Hi, my name is Lauren Wilkins. My student number is 1002-386-009. I'm going to be playing the patient, Joan, who's a 72-year-old woman seeking kinesiology services.
And I'm Haley Neal, student number 100-214-6448, and I will be playing the role of the kinesiologist. Hi, Miss Campbell. How are you doing today?
I'm well, thank you. You can call me Joan.
Hi, Joan. So I'm Haley. I'm a registered kinesiologist here at the University of Toronto Kinesiology-Clinic. It's nice to meet you.
Very nice to meet you.
All right, Joan. So what brings you in today?
Well, recently I noticed a struggle to complete my daily activities, and I was really hoping that you could help me.
Yeah, for sure. I can definitely help you with that. First, we're just going to go over what the treatment services are going to entail.
Okay.
So what we're going to start with is just going over like a brief health history of you. I'm going to ask you some questions, and then we're going to do an assessment. So for this, I'm going to put my hands on you. We're kind of going to do a physical assessment that might include some walking, some balancing tests, some flexibility tests, just to kind of see what your baseline is, where we can start, and then we'll make a treatment plan from there. So some of the benefits from this might just be like increasing your mobility, kind of increasing your energy so that you can really walk up those stairs, increasing your range of motion and your strength. But some risks I just want to let you know is you might have some muscle soreness after, or there might be some other events that could happen which we don't expect to, such as falling or fractures or anything like that. So I'll just give you the consent form and you can read it over yourself, and then you can just sign at the bottom whenever you're ready if you do consent to the treatment. So we're going to start with your health history. If at any point you want to withdraw your consent, you are allowed to. Just let me know and we can stop services. So just to start, I'm just going to ask you, do you have any current medical conditions or prior medical conditions that I should be aware of?
I was recently diagnosed with osteoporosis. Any medications for that is typically just my vitamins. I recently did a bone density scan that came back normal. And I recently just finished an appointment with my physician who gave me the okay to start my exercise, and that is what sort of lead me here.
Okay, perfect. So just going off that as well, do you have anything else, like any areas of pain or that you've noticed when you're like participating in any like activities throughout the day or during physical activity?
No, I don't really experience pain when engaging in physical activity.
All right, so on the topic of physical activity, we're going to work through what's called the Get Active questionnaire. I'm just going to ask you a series of questions. You're going to answer yes or no to them. For the first few, it's whether this has happened in the last 6 months. So you've had a diagnosis or treatment for heart disease or stroke, or you've had pain in your chest while doing activities of daily living or exercise.
No.
And whether you've had a diagnosis of high blood pressure.
No.
Dizziness or lightheadedness while exercising.
No.
All right, have you had any shortness of breath at rest?
No.
Loss of consciousness for any reason?
No.
And concussion?
No.
All right, so moving on. Do you currently have any pain or swelling in any part of your body from like an injury or arthritis that causes you or affects your ability to participate in physical activity?
No.
And has a healthcare provider told you that you should avoid or modify certain types of physical activity?
No.
And then finally, do you have any other medical or physical conditions such as diabetes, cancer, osteoporosis that may affect your ability to participate in physical activity?
I have a recent diagnosis of osteoporosis.
Yes, we did discuss that earlier. So now I'm just going to ask you a couple questions about your physical activity participation. So how many times per week do you participate in moderate to vigorous physical activity? So that'd be like brisk walking or jogging.
I try to do at least 2 days a week, but I have to take care of my husband and other things around the house, so it definitely makes it difficult.
All right, and then of those 2 times a week, how many minutes do you usually participate in?
No more than 15 minutes.
Okay. All right, so that's going through the Get Active questionnaire. So now I just want to understand what you want to get out of this assessment and what your goals are, so then I can develop the best treatment plan for you. So if you want to let me know, and I'll write them down.
Yeah, for sure. So one of my main concerns is trying to maintain my independence for as long as possible. I want to stay in my home for as long as I can. So really the most important thing for me is to feel comfortable in my own home, and that would really mean increasing my endurance so that I feel as if I can easily walk up and down the stairs when I need to. But I also want to be able to carry out like my daily household chores, such as cooking. The pots are starting to feel really heavy. Laundry is starting to feel really heavy. Even groceries, walking from outside the house inside with those groceries are really tough. And probably finally, I want to be able to feel comfortable with my balance. I'm really feeling like unstable, so probably the most when I'm getting out of chairs or trying to sit in chairs. Getting out of bed, I feel just very unstable, so I want to feel comfortable and reduce my risk of falling.
All right, great. So we'll definitely work towards those goals. All right, so we're just going to start our assessment now.
Actually, Hayley, I was wondering if I can ask you a couple questions before we start.
Yeah, for sure.
So I've seen a physiotherapist before, and I was actually wondering, is there any really difference between a physiotherapist and a kinesiologist?
Yeah, so our main difference is we kind of focus more on your performance. We want to improve your functionality in everyday life, whereas physiotherapists more focus on like rehabilitation. So after like injuries, we can kind of cross over into rehab, but we focus more on the performance and functionality.
Okay, perfect.
All right, so for this first test, we're going to do a sit and reach test. So this is just kind of to measure your flexibility, and we're just going to start just to see where your baseline, so we can see how we improve it throughout the treatment plan. So all I want you to do is just reach your fingers all the way to your toes.
Okay, so is there some sort of goal I should be reaching? Should I be going beyond my toes, or?
We just want you to go as best as you can. So we just want to see where you're starting off, so we can see if there's that improvement throughout the treatment plan.
Okay.
All right, so whenever you're ready, and then I'm just going to measure from your fingertips to your toes how close you get.
Okay, for sure.
All right, is it okay if I touch your back?
Yeah.
All right, so I'm just going to straighten you out a little, and then just see as far as you can go. Perfect.
I think that's as far as I can go.
Okay, so I'm just going to measure now. Awesome.
And can I let go?
Yeah, you can come back up. All right, so the next assessment we're going to do is the 30-second arm curl. So I'm just going to give you this weight, and what you're going to do is you're going to start with your arm down at your side, and in 30 seconds you're going to see how many arm curls you can do. You're going to come to about 90 like this. You're going to see how many you can do in 30 seconds, all right? Do you have any questions?
Actually, I do. I'm really concerned about my osteoporosis and putting weight on my joints. I'm really nervous about breaking a bone, and I'm not sure if this is the best sort of exercise for me.
So we actually know that exercise and doing like weight-bearing exercise and strength training is actually very good for osteoporosis. So this will actually help you with your strength. All right, so I'm going to start the stopwatch, and then you're just going to see how many you can do in 30 seconds. All right, ready, set, go. All right, so our next assessment is going to be the 2-minute step test. So this is just to look at your endurance. So what you're going to do is for 2 minutes, you're just going to bring your knees up to my hands. I'm going to keep them here, and we're going to see how many steps you can do in 2 minutes. All right, do you have any questions?
No, I think I'm okay.
All right, so ready, set, go. All right, so our next test assessment we're going to be doing is a balance assessment. So we're just going to kind of see how your balance is. So first we're just going to start with a 2-foot balance. So you're just going to put your feet together like this, and we're going to hold it for 30 seconds. If at any point you need to grab the wall to help yourself, I'll just make note of that in your chart. And if you step away at all like that, then we're going to start over, all right?
Okay.
All righty, 3, 2, 1, go. Nice job, you did awesome on the 30 seconds. So the next one we're going to do, just to make it a little more challenging, is it's going to be a semi-tandem. So what you're going to do is you're going to have one foot, and you're going to have the other foot slightly in front of it like that.
Okay.
And if at any point, again, you need to use the wall, you can hold on to that, and then once you step away, then we'll stop the time, all right?
Okay.
All right, 3, 2, 1, go. All right, so nicely done with your assessment. So now we're just going to discuss the results of your assessment and kind of devise a treatment plan for you. So just start with your flexibility one, which is the one where you had to reach for your toes. You were average for that, so your numbers were very similar to your typical age group. And then for the arm curls as well, you were average for that, but I know you kind of wanted to improve like your grocery, like being able to pick up your groceries and your like laundry and stuff. So we can definitely add some exercises in to improve you, so maybe you're a little above average, so then that is easier for you. And then for the 2-minute step test, which was testing endurance, you were a little below average. And as well for the balance test, you were a little above average. So we'll address these things in your treatment plan. So do you have any questions about that at all?
No.
All right, so we'll move into your treatment plan. What I've kind of thought for you for your treatment plan is we have actually at this clinic, we have some Nordic pole walking classes. So you could do that once a week. It's actually with a group of individuals that's of a similar age to you. And some of them have osteoporosis as well. And it is supervised. So I know you were kind of a little worried about doing some stuff on your own. So at the beginning, all the stuff we'll give you will be supervised so you feel comfortable in that situation.
Actually, Hayley, can you explain to me what Nordic pole walking is?
Yeah, of course. So what you'll be doing is you'll be going for walks kind of around the area of the clinic with Nordic poles. They kind of look like ski poles. That'll help you with your balance. It also activates more muscles because you're using your arms when you're walking as well. So it'll kind of help with like whole body strength, but it'll also increase your endurance.
Great, that makes me feel a lot more comfortable working with other people and having the poles for support.
Great. And so the next thing is I'm thinking of putting you in an exercise class. It meets twice per week and it's a 6-week long program. And it's supervised. It's very small classes, only around like 5 to 6 people, so you still get that one-on-one feeling. And they'll be there to like monitor you the whole time. And so it'll focus on like increasing your endurance, like the Nordic pole walking, but you'll also do some balancing exercises throughout, some arm strength to help with like the lifting of the pots and stuff that you said, just doing it throughout. So you'll start off with doing these classes twice per week for 6 weeks, and I'll meet with you every like 3 weeks just to check in to see how you're changing from baseline to make sure that we're actually seeing an improvement, and if we're not, we can kind of change your plan. And then after the 6 weeks, we'll go down to doing 1 class per week, and then you can do some of these exercises at home by yourself. Hopefully you're feeling more comfortable doing them on your own, but if you're not, then we can keep doing the 2 classes per week, and maybe at 12 weeks, we can start doing them at home.
Okay, sounds good.
All right, so I'll show you a couple of the exercises that they typically do in the class, just so you have an idea, and maybe you can try some as well.
Perfect, sounds good.
All right, Jones, this ends our appointment for today. I just wanted to make sure you didn't have any final questions or you need me to clarify anything before.
For sure, I just want to make sure that I didn't forget anything. So going forward, the treatment plan is going to be 2 days a week. It's going to partake in an exercise class. It's still going to be one-on-one, correct?
Yes.
Okay.
Well, it's going to be in like small groups, but it'll only be about 5 to 6 people, so you'll still get that one-on-one experience.
Okay, for sure. I think that's all my questions. I'm really excited and looking forward to working with you.
All right, it was great to meet you, Joan. Thanks for coming.
Thank you so much.